In terms of budget, the largest federal department in the US isn't the Department of Defense. It's this one, the Department of Health and Human Services. Its purpose is to enhance the health and well-being of all Americans. And as of February 13th, it's being run by this man.
There's no vaccine that is, safe and effective.
Robert F. Kennedy Jr. He became a political force over the last 2 years with a promise to make America healthy again. But before his confirmation, over 22,000 doctors signed a letter urging the Senate not to confirm him. The letter called Kennedy unqualified and actively dangerous due to his long history spreading misinformation about vaccines. Today he says,
I'm supportive of vaccines.
With a qualifier.
I want good science.
And now he's seated at the helm of a department that oversees the exact science that he's been undermining for years. So as health secretary, what sort of power does someone who doesn't trust the science have over vaccine policy in the United States? HHS, the Department of Health and Human Services, made up 25% of all federal spending in 2024. This includes funding for Medicare and Medicaid, both multi-billion-dollar federal insurance programs. Together, they provide health insurance for nearly 40% of Americans.
There's virtually no part of the health system that isn't directly impacted by HHS.
Secretary Kathleen Sebelius speaks from firsthand experience. She served under Barack Obama in the role. The Secretary of Health and Human Services oversees 13 divisions. Here's Medicare and Medicaid under one agency. But there are at least 3 others that you're likely familiar with. One is the NIH,
National Institutes of Health, the world's premier research entity. It does funding for research, it does research itself, coordinates research efforts, not only in the United States, but all over the world.
Another is the CDC,
Centers for Disease Control and Prevention. They're the nation's, and in many ways, the world's disease detectives.
And there's also the FDA.
Food and Drug Administration.
Things like EpiPens and pacemakers, food additives and infant formula, medications, and yes, vaccines all need to pass FDA approval before going to market. Typically, these agencies mostly function autonomously. The health secretary rarely intervenes in their day-to-day operations and decision-making. But they absolutely have the power to. So what sort of control does that give a health secretary over vaccines specifically?
There is a protocol for vaccines, and each piece of it lies within HHS.
The ways a health secretary can impact vaccine policy can be broken down into a few buckets. Research into future vaccines, regulation, as in the approval of new vaccines and oversight of existing ones, and guidelines, recommendations on who should get vaccines and when. A lot of this requires a careful balance between public and private sectors.
A lot of the exploratory research a private company would never invest in because the return on that investment, they just can't do it. But the federal government can. We can take bigger risks than they can. We can then hand it off to the private sector.
For example, the recent development of an RSV vaccine was built on decades of research handled by the NIH. The Trump administration has recently made major cuts to this agency.
We are slashing indiscriminately those programs, that research, that generation of new talent who will go elsewhere.
As health secretary, Kennedy said he would tell the NIH to take a break from infectious disease. But he's also making moves to freeze private contracts. He's already paused at least one contract that was working on an oral COVID vaccine, and is reportedly considering cutting funding for a bird flu vaccine. It's not just budget cuts. Kennedy can also commission biased research. The Washington Post reported that he's tapped a vaccine skeptic to head a study on the long-debunked link between vaccines and autism. Next, there's this. The FDA is in charge of regulating vaccines in the US. This includes the process of approving new vaccines and overseeing the ones already on the market. A health secretary that doesn't trust the agency could completely upend that process by, say, postponing meetings or demanding extra layers of oversight.
And that's an additional step that requires months and months and months because there's notice that has to be given and appointments that have to be made and notice before they can meet.
But could a health secretary pull an approved vaccine, like the MMR vaccine, off the market? That would actually be incredibly difficult.
There is a process, but you would have to have a lot of evidence.
A health secretary would have to prove it causes harm, and that data simply doesn't exist. So someone like Kennedy could slow the approval of new vaccines, but it's unlikely he'll pull the ones we have from the market. Plus, he has said,
I'm not going to take away anybody's vaccines.
The thing is, he doesn't have to pull a vaccine from the market. After FDA approval, the CDC does its own set of research and determines who the vaccine is for. At this stage, they determine the right guidance. And that's all it is, a recommendation.
There is no mandatory federal vaccine mandate. It doesn't exist. People always talk about big government and vaccine mandates. Those decisions are made at the state level.
But these federal recommendations are viewed by health professionals and state officials and are often used to set mandates for things like schools at the local level. A health secretary can direct the CDC to adjust these recommendations. They can also replace members of the CDC's Advisory Committee on Immunization Practices, a group of independent public health experts and medical professionals that advise on vaccines, swapping these advisory members with people who more closely align with their ideas, like vaccine skepticism. If those experts change the recommendations on who should get vaccines when, that could have a big impact. Because typically,
CDC approves it and recommends it, then the federal government will pay for it under their insurance programs, and then private insurance companies will follow suit.
If the recommendations aren't there, it's possible that insurance companies would deem the vaccines unnecessary. And that would make it significantly harder for people to afford vaccines. These are all actions the health secretary could take on their own, but they could also offer up programs for Congress to cut. Like the CDC's Vaccines for Children program that provides vaccines to children of low-income families. But even still, one of the most powerful things a health secretary can do to affect vaccine policy in the United States is keep talking.
By voting to confirm Mr. Kennedy, we would be telling our constituents he's worth listening to. That alone could get people killed.
Just the bully pulpit of being the health secretary of the United States of America.
Let's look at his response to one of the worst measles outbreaks the US has seen in years. First, he incorrectly said that measles outbreaks are
Not unusual.
But measles was declared eliminated in the US in 2000. Outbreaks of this scale are rare and nearly non-existent in communities where at least 95% of people are vaccinated.
We know that the most effective thing for measles is vaccinations. And you have to jump on it very quickly because measles is a very, very infectious disease. If a person with measles walks into a room where there are 10 people who are unvaccinated, 9 of them will get measles.
Later, Kennedy took to Fox News and wrote an article that at first glance seemed to flip his stance on vaccination, but also left plenty of room for interpretation.
A casual reading of the article will give you the impression that, you can get vaccinated if you want to.
He also goes on to credit good nutrition as the best defense against most chronic and infectious illnesses. Here's a statement on measles from the CDC, which he now oversees. It starts with, vaccination is the best defense, but now list vitamin A as a treatment.
And he's out promoting it as though it's equivalent to vaccinations. That's very, very dangerous. And it's very dangerous coming from the nation's chief health official.
Vaccine hesitancy is rising around the country, as are exemptions for vaccines in schools. Lower vaccination rates increase the risk of outbreaks and make those outbreaks harder to stop. Kennedy is amplifying this by sowing distrust not just in vaccines, but in the entire system of scientists, physicians, and researchers that make up the very department he now runs. While he loudly gains a following, he can quietly cut financial access to vaccines for millions of people and stunt research and development for decades to come. We'll have to wait and see what Kennedy will do and how those choices will ultimately affect his mission to make America healthy again. Okay, thanks for watching. So I wanted to make this video because I've been seeing a lot of really alarming things about what RFK Jr. believes about vaccines. And so I wanted to look into what he might have the power to actually do in his new position. And to figure that out, I had to do something that probably sounds really exciting, which is learn as much as I could about the US Department of Health and Human Services. We like to look into questions where the answer is less about what people are saying and more about how the world functions. If you like that approach and want to support it, you can do so over at vox.com/memberships. Thanks.